Hi, Dr. Lon Simkis, Fertility Partnership, nestled in the heart of America, St. Peters, Missouri. We are the Fertility Partnership, and we've been up and running for 15 years. A few patients that I met last week or so made me realize I need to speak to you about corporate medicine. Fertility Partnership has been approached by corporate entities to purchase us, to engulf us. Resistance is futile, you'll be assimilated kind of feeling. But I looked at it, and I'm well aware of the fact now that it appears to me that most IVF is now being done in some sort of a corporate setting, whether it be a hospital or usually what we're seeing now is venture capital groups buying up programs. And so I feel like I need to talk about this. Why? Because I feel like Daniel Boone out here. I'm not the only one. There are plenty of fertility programs that are independent, but I'm sure we're all getting approached in one form or another. But my own experience, years ago, decades ago, I came out of my training and I came to this town and I joined a group that actually gave me access to the training that I needed to do IVF, to become a reproductive gynecologist. I trained with another doctor who was actually a urologist, and then anyway, I learned, great opportunity. But for those first 2 years, I was part of this group. And then they decided to sell themselves to what was going to become one of the largest corporate medicine groups in our area. The deal wasn't a good deal for me, but not because of the corporation so much as because of the partners. But I was part of it for almost a year. I didn't sign the full contract. I did a temporary thing because I wasn't sure if I wanted to work for them. And lo and behold, I got a glimpse into the future. I was a part of it for a year. And I saw that the whole decision-making process, the people who were going to be running medicine were not doctors, weren't people who had taken an oath. It was, yeah, true, doctors can be just as greedy as money people. That's fine. Yeah, I know that. That's human nature. But when you have a corporation, that's what it's there for. It's there to make money. And doctors, one would hope, have a different drive, and that is to take care of our patients. It's not a pure distinction, but it's there. I don't think medicine should be in the hand of people who are there trying to make as much money as possible out of the whole fact that if there's a patient who needs help. Anyway, I was a part of it. I looked into the future, and I'm not immune. There are these venture capital groups who have come around and talked about buying us up, and I looked at it, and it's not for me right now. Perhaps will ride out my career, but you never know. I just want people to understand, though, that this is where medicine is going. Decisions are going to be made. What are the most profitable? And the people who are more interested in making sure you're okay, the doctors hopefully, are not going to be in charge. And that's scary to me, but it's a fact. So when you need to have a baby, I would put forward to you that you look at a place like ours, which is owned by private doctors, whose sole purpose is to get you pregnant. At Fertility Partnership, we want to do that, get you pregnant, and we want to do it as inexpensively, but yet as effectively as possible, and that's been our goal. And I've been doing it, I think, longer than anybody. And if you don't believe me, go to Newsweek magazine in July 10th, 2010, and you'll see the article written about Fertility Partnership, how we were going to bring down the costs of IVF. And I'm very happy that now there are other programs who are doing it, who are trying to bring down the cost. It's great. It's great for patients. I think we're experts at bringing down the cost, but yet maintaining very high success rates, and you can go to the CDC to see what they are. Fertility Partnership, helping families grow. Go ahead, have a baby, and wake up in the middle of the night. Well, we'll skip all that, but Fertility Partnership, peace out, build families.